All right, my name's Hannah Murphy, and this is my video on tuberculosis. So, the respiratory system is comprised of nose, nasal cavity, sinuses, pharynx, larynx, trachea, the bronchial tree, and the lungs. And the purpose of the respiratory system is to carry out respiration. There are three different kinds of respiration: external respiration, which is the act of breathing; internal respiration, which is the transport and exchange of the gases inhaled um, throughout the body. And then cellular respiration is the utilization of oxygen in the cells to produce ATP. Um, the jobs of the respiratory also include gas exchange, removing particles from incoming air, controlling humidity and temperature of the incoming air, creating vocal sounds, the sense of smell, and regulation of blood pH. And here I have a little closer look at the alveoli, and that is actually the functional part of the lung. That's where the gas exchange between the inhaled air and the blood through the pulmonary circuit. That's where that gas exchange takes place. This is at the end of the bronchial tree. Now the disease we're looking at is tuberculosis again. So this is a contagious disease characterized by infection of the lungs. The bacteria that causes this disease is Mycobacterium tuberculosis. There are three stages of contraction. The first one is the primary infection. Now this is typically the asymptomatic kind of stage. There's some coughing, maybe a fever, but the bacteria is killed by immune cells. The latent infection happens a little later on after the primary infection. This happens if cells were not totally killed off by the immune system response. So the immune cells will kind of build up a wall and block off the bacteria in the lungs. When the active disease can actually happen months after the primary infection occurs. And this happens when the immune system can't control the infection anymore. And that's where you get, the coughing up blood, the general characteristics of tuberculosis. Now, there's a little kind of side note here. Tuberculosis can actually leave the lungs and start to affect other systems, like the lymphatic system in particular. And this is called extrapulmonary. And the bacteria, like I said, multiplies in the lungs and it destroys the lung tissues. So the bacteria actually hardens up the tissues that make up the alveoli and the rest of the lungs. And this is called fibrosis. This actually inhibits a lot of that gas exchange from going on. And then we've got necrosis, which is the actual death of the lung tissues. And inflammation, that is a big key here in this disease, is the inflammation of the lungs as an inflammatory response from the immune system. Signs and symptoms: cough, fever, fatigue, loss of appetite, weight loss, chills or cold sweats, and chest pain. So one major characteristic of TB is a persistent dry cough. You may also cough up bloody mucus. And this relates to the disease because there's damage to the lung tissue. So you'll actually be coughing up the blood that comes in from that damaged and dying tissue. And a lot of these other symptoms, like the fatigue, fever, loss of appetite, weight loss, all of that is actually consistent with the symptoms of an immune response in the body, especially that fever. So for diagnosing, there's multiple tests they can run. I have here skin. What they'll do is they'll inject, it's kind of similar to an allergy test where they'll inject a little bit of, the activated TB under the skin, and the provider will monitor your skin, and I guess they'll determine whether you're positive or not based on how big that like a lump, like say in Victor would be like a bigger lump, and they'd watch for that. X-rays, they will take a scan of your chest, and by doing that, they'll actually be able to get eyes on the patches of bacteria that are taking over your lungs. And then the sputum, urine, breath, blood work, those tests are here to determine whether the bacteria is in your lungs and or in your system. Same with the cerebrospinal fluid. That kind of determines the extrapulmonary infection. Treatments: there is a vaccine, the Bacillus-Calmette-Guerin vaccine. That's not very common in the United States, but it is very common in countries that have higher TB rates. Now there's a list of medications here, and that seems to be the primary treatment, especially in the US. So the kind of thing is make sure you take all of your medications at a time. And it seems like they would provide or prescribe 3 or 4 of these medications at a time. And you have to take these, as prescribed regularly, and treatment can be as long as 3 to 9 months. And make sure you follow up with your care provider regularly. And here are the references. Thanks.